Dr. Harari is a psychiatrist with an interest in women's health. This interview continues our series on women's health. And today we talk about a condition that I had never heard of before called PMDD, or Premenstrual Dysphoric Disorder. We'll define what that is, symptoms, treatment options, and we're going to learn lots from Dr. Harari as usual.
I think that everyone's general understanding of PMS is very much what we depict in Hollywood or what you see on TV shows or what you see on Instagram is that it's the time of the month and your girl gets real grouchy and you have to just throw her chocolate from across the room. And we kind of, we poke fun at that. But at the same time, it's really not as it's maybe it's not something we should make too much fun of, but we just kind of laugh it off. So the difference though, so what does it even stand for? So PMS versus PMDD. Okay, this is the way I like to say it: premenstrual dysphoric disorder, PMDD, versus premenstrual syndrome, PMS. The difference between the two is that PMS is kind of like the annoying friend or the annoying cousin that comes and visits you once a month and they hang out and they're annoying, but you get through it and everything is fine. Okay. Versus PMDD, who is perhaps a very, very toxic friend who comes and stays with you for a whole week and just causes complete havoc in your life. Okay. So, that's where we're seeing that it's more debilitating, full on mood changes in PMDD. So we're seeing clinical depression symptoms, rage, anxiety. For some patients, they can even have a mild to moderate to even severe psychosis. So it might look like you're seeing someone who's having a bipolar disorder, like a mood fluctuation, and it happens for about a week, and then their period starts, and then all of a sudden they feel better, and it's like nothing ever happened. And it's very, very confusing for women, and it's very confusing for the people that they work with, the people that they live with. Is what is this Dr. Jekyll and Hyde? Why does this happen for 1 week out of every month? And then it's like nothing happened at all. It's very confusing, as you can imagine. So I guess the difference between PMS is PMS, you get, as a woman, you want chocolate, you want anything that has magnesium. You're kind of snappy, you're kind of edgy, you're kind of grumpy, um, but you're tolerable. No one has to actively avoid you. PMS is uncomfortable. PMDD is debilitating, and that's why I always say that the two D's at the end in PMDD are it's for debilitating, right? So, why is it important to kind of recognize that there is a difference between the two? Because the treatment for the two is very, very different. So, a lot of times women will experience symptoms of PMDD, but they think that it's just PMS when in actuality, it's very, very different. Um, Symptoms, again, for PMDD, it has such a wide range as well. But the end of the day, the question that you have to ask yourself when you're sitting in front of a patient, or as a patient that you should ask yourself, is, okay, these symptoms, are they affecting my quality of life to the point that I can't function for a whole week out of every month? Okay. So we're looking at symptoms ranging from crying over a cute dog food commercial to literally threatening to divorce your partner at the drop of a hat, right? For maybe breathing too loudly or something. But with the severe irritability, the depression, the anxiety, the bloating, you're still getting all of the other symptoms of PMS, like breast tenderness, fatigue, sleep issues. All those things is pretty much PMS, but put that PMS on steroids with all the other things, right? Most patients that I see, they're getting diagnosed probably in their mid to late 30s, which is really unfortunate, because that's actually at that point, you're in the season of your life where you're getting ready for the big change, which is menopause. So by the time patients are in the perimenopause age, that's when they find out they've been struggling with PMDD. And it's really unfortunate.
I just wanted to ask, do we know the mechanism? Like, is it hormonal? Is it estrogen dropping, progesterone changing? Do we have any idea?
That is a really, really, really good question. There are several theories at this point. Several. No one can seem to quite pinpoint what it is, but it always seems to go back to progesterone. And I always say progesterone, for all the wonderful things that it does, it just seems to be the PMS, PMDD, and postpartum depression, women's worst enemy. It's that sudden shift in progesterone is what it is right now theorized to be, because we're so early in recognizing that this is a disorder and that there is a need to explore it more. I feel like it's constantly dynamic. So I feel like every single time I sit down to do something with CMEs and I see a new article, it has a new hypothesis, so to speak. But I would say that the latest one is that it's the sudden shift in progesterone.
So it's a lot of unknown and stressors and the top of these hormonal changes, and then and not having somebody to listen to you, that and then once they found it, some people, other people like themselves, then I think that's, even there's no treatment, I think they feel better. They're not, they ask me, for example, is this in my head? I says, no, this is something. I explain it to them as a Charlie horse or spasm in your leg. Says when you have that, you feel it true, but you can go to emergency room, maybe CAT scan, EMG is negative. It doesn't mean it needs suturing, but what you're feeling is true, and that's sort of sometimes will help them to calm down when then get appropriate treatment, and with a diet and many tips. And each person is different. It's just based on their age too. So what do you see the future of this? What do you see on the horizon for this type of people?
I feel so hopeful actually, because I'll be honest with you, and I do feel like with all the challenges of being, I'm a millennial doctor. My husband's a millennial doctor. I think we have our own, every generation of doctors has its own unique set of challenges. Um, I I will say that I feel hopeful because within, I think, my generation of doctors, and I'm not sure where the shift, when and where the shift happened, but what I have noticed is the collaboration seems to be there between specialties. For instance, look at what we're doing right now with our podcast. Look at this episode, and what's happening is, let's say 10 years ago, you didn't have this option to be able to type in PMDD and be able to hear two very, very, very experienced physicians sit down with a psychiatrist and share their thoughts and share their experiences on what's going on. You didn't have that resource. You didn't have Instagram where you can follow hashtag PMDD support. You didn't have YouTube videos. You didn't have ChatGPT to even point you in the right direction. So I actually feel very hopeful. As toxic as social media can be, I think that all these tools, when used appropriately, can actually be a good thing. It really can. So I see a world where, when we have the talk with our daughters about, oh, guess what? Your body's going to go through some very fun changes. I think that my generation of mothers, we are more aware of PMDD because we've heard it so many times, and we can kind of observe our daughters and see, okay, for 1 week out of every month that my daughter is going through her period, is it that she's struggling for about 1 week, or is she struggling for a good 2 weeks, 3 weeks? Because that's the other thing that I do want for the audience to take away is the classic story that I hear from a woman who comes in with PMDD is, doctor, I only get 1 good week out of every month. 20, that's 25% on average, right? When we say usually there's only 4 weeks in a month, I get 1 good week. So I'm only living really 25% of my life since my period started around the age of 11 to 13, maybe 14. And when you break that down, this is why. The week before your period, if you have PMDD, the week before your period, life is awful. Everything's awful. Everyone hates you. Nobody likes you. You don't even want to exist. You can't work. You can't do this. You can't do that. Nothing makes sense. And then your bleeding starts. And then all of a sudden you realize, oh, it was my period. Everything's okay. But then that 1 week that you're on your period, it's so uncomfortable and gross, and you feel bloated and nothing feels right. and your skin's breaking out, and it's just like, wow, so glorious to be a woman. That's 2 weeks. Okay. The week after your period is done and you're feeling more like yourself, that's when you sit down and you reflect and you realize and you feel ashamed and embarrassed at the behavior that you maybe had during that 1 week before your period, and how you snapped at your partner, you snapped at your kid, you yelled at your dog, you got in a fight with your neighbor, you sent a snarky email to your boss. That's when all the shame and regret settles in. And then after you settle with that, the next week feels normal. And then guess what? The horrible week from hell starts all over again. And it's a horrible cycle. So if you notice that in somebody that you love or someone that you know, I guess it's something to be aware of, that maybe this person is actually struggling with PMDD and they themselves don't know it.